Hi, my name is Adeline Albert, and I am beginning our presentation for Group 1. In our group, we have Melanie Atkinson, Rachel Miller, and Kanisha Wardle, and we've done our project on HIV/AIDS in South Africa. So, according to AVERT, the non-governmental organization at the forefront of the AIDS epidemic in South Africa, they say that South Africa has the biggest and most high-profile HIV epidemic in the world, with an estimated 7 million people living with HIV in 2015. Excuse me, in that same year, there were 380,000 new infections, while 180,000 South Africans died from AIDS-related illnesses. South Africa has the largest antiretroviral treatment program globally, and these efforts have been largely financed from its own domestic resources. The country now invests more than $1.5 billion annually to run its HIV and AIDS programs. But despite these intense efforts, the epidemic hasn't shown signs of slowing down. The risk of contracting HIV is higher among men who have sex with men, sex workers, people who inject drugs, children who contract it from their mothers, and young women. Being open with healthcare providers, testing regularly, and avoiding risky behaviors are all important to prevent the spread of disease. In order to decrease the prevalence of HIV/AIDS, we are going to implement a program to educate rural and at-risk populations about the behavioral changes necessary to prevent the spread of the virus. So for our particular intervention, we're going to educate young kids in primary schools and increase awareness of the transmission of HIV/AIDS. Teach comprehensive sex HIV information before the onset of sexual activity, and distribute free condoms to both males and females in at-risk populations. So now I'm going to turn the time over to Rachel.
Hi everybody, I'm Rachel Miller. Our intervention will not solve the problem of HIV/AIDS. However, it is a step to reduce the spread of the virus. This has been proven to be an effective intervention strategy through an active learning environment where students can engage with the material, think about what they are learning, and develop skills that will help them make healthy life choices with regards to their sexual behavior. By distributing condoms, we are promoting safe sex behavior. We are going to go about the implementation and intervention by reducing new HIV/AIDS infections. We are going to educate the people. We're going to do different schools, community meeting places, and lecture halls with a set lecture and presentation to deliver, as well as distributing condoms. We will increase access to care and improve health outcomes for people living with HIV and establish a system to link people to care immediately after diagnosis. We will do this by creating a safe location where people can be treated for HIV and have a location where people can be screened for the disease and learn how to cope with the disease. We are also going to reduce HIV-related disparities and health inequities. We are going to create a better system of educating the population, provide them with resources to prevent HIV/AIDS through distributing condoms and providing screening centers. We'll also treat those with HIV/AIDS and educate them about their disease. We are also going to reduce the stigmas and discrimination associated with HIV status and services by educating the population and creating locations. With our program, we are planning to hold it in 2 primary schools in the rural South Africa. Our first location will be at the Hudson Park Primary School, and this is in the city of Eastern Cape in South Africa. Our second location will be at the Tain Primary School, which is in the Gauteng province in South Africa. We plan on expanding our program to other rural locations in South Africa if our program is successful in these 2 locations. And next, Melanie will be talking about our lesson plan.
Hi, my name's Melanie Atkinson, and I will be discussing the lesson plan material that we will be educating the students at these 2 primary school locations. Our goal is to help these students understand and be able to analyze the HIV and AIDS epidemic. Also, how it impacts people around the world. The lesson topic for lesson 1 will be HIV transmission and prevention. Our objective during this lesson will help students be able to define HIV and AIDS. Students will also be able to identify ways that HIV can be transmitted from one person to another. We also want the students to be able to understand how HIV can spread rapidly and help them to identify ways to prevent the spread of HIV. We will prepare a short quiz for the students to take, and this will assess their knowledge before proceeding with the unit lesson. As we go over the answers with the students, we'll be able to discuss ways in which HIV is transmitted. We'll have the students share their ideas of what they believe HIV and AIDS are, and help them to explain the difference between the 2, HIV and AIDS. During this lesson, we will prepare small cards for each student. We'll mark the cards as follows: 1 card with a blue dot, 1/3 of the cards with yellow dot, and 1/3 of the cards with a green dot, and 1/3 of the cards will be left blank. Each student will sign their name in the top corner of the card. And as the students walk around the room signing each other's cards, we'll give them about 5 to 10 minutes to do this and have them come back to their seats. After this is completed, we'll inform the students that this was a sample exercise of how quickly HIV can spread within a community. We'll ask the person with the blue dot on their card to stand up and explain to the students that this represents the person infected with HIV. We'll go on and tell them how someone that has HIV, you can't tell by just looking at them. Most people who are infected with HIV don't show the visible signs or symptoms. We'll continue to go over how HIV is spread and reinforce that it cannot be passed through casual contact. By the students signing the cards, that represents that they are having sex with another person. We will explain that with unprotected sex, HIV spreads quickly through a community. We'll introduce the idea of the prevention, ask the students with the green dot on the card, and inform them that every person with a green dot on their card said no to unprotected sex and therefore is not infected with HIV. Those with the green dot may sit down, and then we'll inform the group of those students with the yellow dot on their card. They were the ones that used a condom consistently and correctly every time they had sex, and therefore were protected from HIV. We'll continue on with the next group of those who did not say no to sex and did not use a condom, and therefore put themselves at risk and could be infected with the HIV. After this simple activity, we'll discuss the questions with the students. First, we'll ask them how this exercise helped explain how HIV spreads so quickly. Additionally, to think that in real life, HIV is often passed from one person to another without someone realizing that they are infected, and why this is. Their exit from the class or from the instruction will be to review the list of how HIV can be transmitted and have them to be able to write down the specific ways that HIV can be prevented. We'll now turn the remainder of the slide presentation to Kenesha Wardle.
Hi, so I'm just going to go over some of the barriers we might encounter while trying to implement our program. One of the barriers we identified was finding supplies. We weren't sure where we would be able to access the necessary supplies. Another barrier was transportation. We know that our program will be held at a school or community center, but we do not know how to transport people who are further away from these locations to where the program will be located. Another barrier was incentives. We wanted to be able to find a way to provide food or water or maybe even food stamps of sorts to the more rural areas of Africa as incentives for completing our program. Another barrier we identified was village hierarchies. We thought that maybe in certain villages or tribes, elders may disapprove of our program and prevent their men and women from attending our program. The last barrier we identified was funding. We weren't sure how we would receive funding for the program. For overcoming these barriers, we identified for supplies that we would be able to work with non-governmental organizations who have experience working with HIV/AIDS and to see where they get their supplies. We would also request supplies when by requesting and applying for governmental funding or sponsors and grants. We would overcome the transportation barrier if funds allowed by providing a small transportation for populations out in more rural areas away from our meeting places per diem. Overcome incentives by, again, as funding allows, we would work with the non-governmental organizations in the area to learn about what incentives they've used in the past and which ones were successful and implement those successful incentives in our intervention. For village hierarchies, we would include, make sure to include men in our program. We didn't want to paint men in a negative light. We wanted to include and educate both men and women. We would also design the program to not demonize anyone or their beliefs, but highlight the risks that HIV/AIDS transmission presents and empower everyone to make less risky decisions. For overcoming our funding, we plan to seek governmental funding since we're not sure how much of the program would be covered or supported by governmental funding. We would also seek out sponsors and grants. Use crowdfunding platforms to raise funds as well. This will help cover the supplies, transportation necessary for the program. And just in summary, we wanted to kind of highlight the key points of our intervention. We wanted to make sure we focused on men and women in our education efforts and create a safe environment for both genders to learn about HIV/AIDS, the risks of having unprotected sex, and to educate the people of rural South Africa on HIV/AIDS in general. We want to train locals in the population to administer the HIV/AIDS tests. By training people to administer these tests, we can minimize the costs and improve access to people, improve the access people have to testing. We will reach out to rural South African communities in a trial run of the proposed lesson plan and intervention. This will provide an educational opportunity to empower the population and citizens to make decisions to prevent the spread of HIV/AIDS. We hope to destigmatize and destigmatize the conversation around HIV/AIDS, both the spread and any myths related to people who are infected with the disease. To fund this program, we would rely on governmental grants, but if they're not enough, we would use crowdfunding, sponsors, grants, or other fundraising events. This is just a list of some of our references we use throughout our presentation, but for now that wraps up our presentation, so thanks for listening.